So finally, as part of our Return to Learn strategy, I'm signing a proclamation today that does the following. First, it directs all state agencies, school districts, and local governments to focus on preparing to safely welcome back students and teachers to school in person this fall. Second, it provides clarity for when a school may move to primarily remote learning so that there's no confusion. It permits remote learning when parents select remote learning as the best option for their family. The Department of Education, in consultation with the Iowa Department of Public Health, approves a temporary move to online learning for an entire building or district in response to public health conditions. A school, in consultation with the Iowa Department of Public Health, as well as local public health officials, determines that individual students or classrooms must be temporarily moved to online learning, or a school chooses to temporarily move to online learning because of, this is kind of another example outside of COVID, but that they move to online learning because of severe weather instead of taking a snow day. So I think with the technology that we're bringing on board through the hybrid, that'll be another option for us to address some of those issues as well. And third, it takes a number of steps to address concerns about our teacher workforce, including removing limitations on how often and long substitute teachers can teach, expanding the pool of Iowans who are eligible to serve as substitute teachers to include career and technical teachers already in the classroom, paraeducators, and those with an associate's degree or at least 2 years of college courses. And in summary, and there's more details in the proclamation, so I've just briefly hit on some of them, but in summary, we're working hard at the state level to ensure that local school districts have the resources and the expertise that they need to meet the challenges of today's COVID-19 world. So again, I know this is not going to be easy. I know that it's going to require some changes to how things are done in the classroom, but given the importance of education to our children, the people of Iowa, we owe it to them to just roll up our sleeves and get our schools back up and running safely and effectively. And with that, we'll go ahead and open it up for questions.
So, after the proclamation,
Yep.
schools that are already set to pushing it, so pulling up on Iowa City being one of them.
Yep.
Are they allowed to do that?
No, they would have to go through a waiver. Right now, the expectation is, especially with the core subjects, that over 50% of those subjects be offered in the school building. So under some circumstances, they would have to, with consultation with the Department of Education and the Department of Public Health, based on public health reasons, would be potentially given the opportunity to move to that.
Will your proclamation, Governor, have a threshold for if there's an outbreak when schools switch to online learning? If it's 1 case, 2 cases, 10 cases in school?
So as we indicated earlier, we're continuing to look at the data. I don't know, Dr. Padati, we're kind of targeting, I believe, the first week of August to have that information put together. So we continue to look at the data, we continue to look at the trends, we continue to reach out to expertise in different studies, and there are multiple countries around the world that have actually sent their children back to school. So Dr. Padati, do you have anything you want to add to that?
No, I think I would just echo, again, it's an example of a place, and we know this is hard, but it's an example of a place where we do continue to learn more, right, as a global and national community. And so looking at what we've learned and, what we want to pay attention to with regard to this particular virus and its behavior, those are going to be things we continue to do and support that we continue to provide.
Mm-hmm. Well, yeah, so part of the reason back then there were so many unknowns, as you can all attest to throughout the last 3 months, the parameters have changed and how COVID-19 is spread and how you get it. And so as we continue to learn more about the virus, we have the data and the analytics, and we have best practices. We have examples from other countries and other states that have actually moved through the process that helps inform our the CDC, their cohorts across the country. Every state is grappling with this right now, and so there's a tremendous amount of conversation and dialogue that's taking place to understand what's happening in states and what they're doing and how we can really collect all of that and put the best guidance in place for our administrators and our school districts so that you then can take a look at what's happening in your community and make the best decisions for the students that you serve. So it is going to take all of us, and honestly, as Director Lebo said, it continues to change, and that unfortunately is a reality of COVID-19 and what we've been dealing with over the last 4 months. And so we have to somewhat be flexible and try to do the best that we can. And as I talk to parents and educators and leaders and school board members, that's their goal. Every one of them have the same goal, to do it right, to do it safely and responsibly. But it is imperative, and I would agree with this. I have 10 grandchildren. It's really imperative that we get our kids back in school, and especially those most vulnerable, so we don't leave them behind. And so I think this is the right decision, and then we'll move through it, and we'll see, where we have to maybe potentially adjust going forward.
You heard from the leaders, superintendents, that local control is, critical, and that school districts love local control. A lot of them have already put forward their plans, and now they might have to reassess, get a waiver. I mean, is that not preventing some level of local
Yeah, I think they put forth preliminary plans. I think they were still working on some of the I don't know, Leanne, do you want to address that? I think they're still working on some of the details. And one thing that was made very clear is they would like some more clarification, especially with the legislation that was passed and signed into law, so that to provide some clarification as to what the expectations were from that. It was made clear in the law that if we were going to utilize online learning as one of the 3 return to learn plans, that the governor needed to put parameters in place in a declaration, and so in our proclamation. And so we did that today, and I think, again, it's fair, it's flexible, and it really drives the goal, and I think the intent of what the legislature was trying to do through the legislation, and that is that we should all try to focus on getting our kids back in school, that over 50% of the education in core subjects should be in school if possible. Now, if we have an outbreak or there's something that happens, there is a procedure in place for them to temporarily go online. And that's why that component is so important, and that's why a hybrid was put in place, so that school districts do have that flexibility to address a specific situation and temporarily have the kids continue to learn online until they can get back into school. And so, and we all have to, continue to do the same things that we've been talking about since March 8th. And how we address the pandemic, and so, with the practices that we've been talking about from the very beginning.
One thing that a lot of teachers and superintendents have said is they want their goal also is to have
Yep.
students in school. They're not sure if they can do it safely.
Yep.
If they have to have more students in school in order to comply with the requirements to have them in person for a certain number of days per week, but they don't have space.
Yep.
Out there they would want to. How are they supposed to accommodate? What you're asking them to do, but also do it safely so schools
Yeah.
don't become sites.
So we're innovative, and we're, that's what we do here in Iowa. We're innovative, and we can adapt and be flexible in what we do. But I think, some of those concerns will be addressed in the recommendations and how we handle specific situations moving forward. So again, we're looking at what the criteria looks like. We're looking at what other areas, states and countries are doing. We're collecting the data, and then we'll provide some hopefully some more clarification and guidance that school districts can utilize moving forward. 1st of August is the goal. So, I mean, they're working on it every day, but they're continuing to gather data, and we want to be in the best possible position that we can when we make the recommendations to our school districts. So, I mean, they're late at night. They're constantly evaluating data and looking at the research and talking to other experts that are looking at the same things that our team is looking at. So it's on an ongoing basis, and we know that we need to get this information to you all as soon as we can. So they get that, and they're working really hard to be able to provide that. Well, that would be something that you would need to check with the director of the Department of Public Health. I don't micromanage our agencies. I'm not involved in personnel decisions, and so.
Was she giving out too much information?
No, I was not involved in that decision whatsoever. I believe, well, it's personnel too, so I believe that you just need to talk to the director. I wasn't involved. I don't micromanage our agencies, especially don't get involved in personnel decisions, and so that's, yep. Well, I said at the beginning, schools can do it, and you're seeing that being discussed in school districts all across the state, so there's nothing that prevents them. It goes back to flexibility, local control. Maybe decisions will be different for our elementary kids versus the secondary and our high school kids. There's a lot of variations, and so that's something, again, there's some exceptions are who's providing, how are they utilizing the mask. They can be contaminated when they're touch off, and so those are decisions, and we can provide information that will be made at the local level as well, and based on what they're seeing in their school district, based on how, can they practice social distancing to the extent that we really would like to? Does that need to be, narrowed up because of space restrictions? And if so, then maybe, the mask is an option, or a face shield is something that they can take into consideration. So we want to put all those options on the table, and then, again, give them the flexibility to help design what best fits their need.
Last question. We were reporting to the White House with Iowa in the red zone for the coronavirus cases. We had it looks to be a record number of new cases today. The report said that the state in this red zone should roll back reopening measures amid the surge in cases. Governor plan to take that report into consideration to roll back.
Well, what we have done and will continue to do is to take a look at Iowa data and take a look at the trends and what's happening and the different areas that we're looking at. Our positivity rate yesterday, even with the numbers, was still 7.5%, way below the 30% where it was at our peak. But there's a lot of factors and metrics that we take into consideration when we're making those decisions. I don't know, Dr. Badati, if you've got anything to add to that.
Yeah, I think that those pieces of information and guidance, it's data that we share with our federal partners and have regular conversations, again, about what's going on and expertise and experience at the federal, state, as well as local levels. And so part of what's important in public health and in epidemiology is to take a look at the trends that we see. And as I mentioned, part of what we've been seeing, like many other states over the past several weeks, is an increase among a young adult population in particular, who are not necessarily presenting severely ill, but those numbers are increasing. For example, when we look at the age distribution across the state of Iowa, the single highest age in years that's reported for cases here in Iowa is 21 years old with over 1,300 cases. And so, it's important to keep in mind that we've got a lot of this young adult population who are understandably reporting when we do investigations that they're having a lot of social interactions in settings like bars and restaurants. And so what we do with that kind of information, we look at the big picture, we look at the national picture, the international picture, our state trends, but also our community and local trends to understand what are the recommendations and supports that we can offer and the messages that we can reinforce to help bring those cases down. Again, I think as we've all heard, we all have a role to play in helping to bring these numbers down. And so reinforcing among each other and taking opportunities like this as much as we can to reinforce the fact that we know this is hard, but staying home when you're sick, staying home when you've been a contact of somebody who has COVID for a full 14-day period, doing things like practicing social distancing, frequent hand washing, and using face coverings are all important things that we can continue to encourage each other to do to help to bring those numbers and transmission down.
Thanks, everyone.
Thank you. Thank you.